Uh, Today we will discuss this case that can help us to understand when we can add another anti-epileptic medications or to move to epileptic surgery. So this male patient, 21 years old, he's right-handed. He's a student, came to our clinic with his mother. He was complaining of having this seizure daily. There was no developmental history. There's no prenatal complications. The developmental history was normal. The psychomotor development was normal. The family history shows negative family history of epilepsy. There is no history of prior convulsions, nor chronic disease, drugs. There is no significant head injuries or any CNS infections. So the seizure of this patient started at the age of 4 years. The mother described the seizure as it's abrupt, suddenly occurring cluster, mainly nocturnal. The patient described some palpitation sensation before the onset of the seizure. The semiology of the seizure, the mother described it as started in the left upper limb and lower limb, tonic extension. Then the patient started to show up some bizarre truncal movements. And the seizure is short in duration, it lasts about 30 seconds, and sometimes followed by automatic oral or hand movements or nose wiping behavior. The seizure occurred mainly nocturnal, and it was repetitive, more than 10 times daily. Could be precipitated by lack of sleep. The patient tried several anti-epileptic medications like phenytoin, valproic acid, lamotrigine, and when he came to our clinic, he was on valproic acid, 500 milligram twice daily, and levetiracetam, 1,000 milligram twice daily. The patient insists that he is compliant on medications, and after starting the anti-seizure medication, the seizure frequency decreased to about 5 times daily. He shows general and normal neurological exam, and this is the typical seizure of this patient. You can see the tonic spasm of the lower limb and upper limb. And then the patient started to show some hypermotor activity. Maybe some axial rotation. Nose wiping. Okay. So the patient had several routine MRIs that was normal. At this point, we can say that our patient is following the definition of drug-resistant epilepsy. He has failed trials of two tolerated, appropriately chosen anti-epileptic drugs for adequate time. So the question is, what should we do next? To add another anti-seizure medication, the third one, or to start and move to pre-surgical evaluation? My colleague will help us to decide which option we should use.